get to know some of the working group members, discussing some aspects of survivor research, and getting some input and ideas from all of you who are here at the session, perhaps about, things that SRN might do and about survivor research generally. So we've got 5 panellists plus me chipping in, and we've divided it into 3 sections. The first section kind of around values in our values in survivor research. The second one around survivor researcher identities, kind of what it's like to be a survivor researcher. And then the third and last section around funding and support for survivor research. Just a couple of 3 or 4 housekeeping points before we get going. We have a kind of group agreement, kind of ground rules for the this conference as a whole, which I expect you've already seen, so we'll be following those in this section. If you've got questions, then because this is a webinar format, we need to just kind of ask you to put those in the Q&A, which you can access at the bottom of your screen. And if you've got comments, best place to put those is in the chat. And we'll try to kind of respond to them either by typing ourselves, and also, of course, panellists coming back to discuss topics. Unfortunately, we won't be able to give you a chance to speak, come up on screen and speak yourselves. We'd like to take the chat into, we'd like to save the chat so that we can take all your comments into account when we're planning future activities. So I'm going to go over to the panellists, the first 2 panellists now. And we've got Peter Beresford, who's going to talk about the international importance for survivor researchers and activists of the United Nations Convention on the Rights of Persons with Disabilities. And then we'll have Jacqui Lovell coming in afterwards, and I'll introduce Jacqui in a few minutes. So can we start with you, Peter, then? I can kind of keep to 4 or 5 minutes.
Well, thanks. Hello, everybody. We can't see you, but we know you're there, and it's great to be here for us. This is my focus, the UNCRPD, and I'm going to try and avoid the abbreviation. When a country's policies are inadequate and defective, as I'm suggesting the UK's mental health and welfare benefits policies are, then it's helpful and it's important to look beyond national, international policy principles and requirements. I think that's why disabled people's organisations have highlighted the problems for disabled people posed by Brexit and the abandoning of helpful EU policy principles and standards and requirements. And that's why my focus today for us, particularly as survivors, is the UNCRPD, or as it should be said, the United Nations Convention on the Rights of People with Disabilities, and the support and help it can offer us. And we shouldn't forget that the UN Convention has a broad definition of people with disabilities, which certainly includes us as mental health service users. Recent UK governments have not been keen on commitments to human and civil rights. They've long tried to get rid of our Human Rights Act, and they've not been keen on the UNCRPD. Sadly, nowadays, what governments don't seem to be keen on here is what can be actually a lot of help to us as survivors, and I believe that's true of the UNCRPD. And that's because it isn't all about drugs and diagnosis, about medical models and negative stereotypes and pathologizing mental health service users. It is essentially about rights. It's framed in terms of our rights, not our problems or how we might be a problem. It's framed in terms of government having obligations and responsibilities to us rather than just us having responsibilities to it, which it seems to think of being in terms of being forced often into poor quality work and being threatened by the loss of our welfare benefits. excuse me, as I think our current government welfare reform policy does. While the UK is committed in principle to supporting and advancing the rights of disabled people, including mental health service users under the UN CRPD, its policies, I argue, undoubtedly head in the opposite direction, with cuts in support and increases in control and compulsion. The Convention, however, in principle supports us in relation to health, education, employment, access to justice, independent living, being able to manage with support, that means, and access to information. Yet, government policies, I think, are failing and destructive in all these areas, and that's the evidence of research, including our research. What's most interesting is that while effectively the rights of disabled people, including us as mental health service users survivors, have increasingly been undermined here, in the global south, as I've been finding out by user-led research, in those low-income countries, increasingly user groups have been organising on the basis of and governments implementing the UN CRPD. And I believe that's a road that we, as campaigning, self-advocating survivors and our survivor-led organisations, should also increasingly be taking here. How else than with support like this will we ever escape from the shadows and secure our rights? I believe that the UN CRPD is a powerful ally for us in securing better support, better lives, and improving our life chances. Less poverty, less hate crime, and less stigmatizing, and less inappropriate responses to our distress. I believe also that it offers a helpful social model, rights-based framework, which we know survivors value for our research. We've got to make the UN CRPD much better known to many more survivors. I think that's a real role for researchers there. We must highlight it in our campaigning. We must gather more evidence about it. We must fight for the different provisions it includes. We've got to address it, I think, as a starting point in much of our research. It even offers a practical way of moving from the present poor situation we are in forward to better lives and support through its idea of progressive realisation, offering governments a route map for achieving real change over time with and for us, and securing the resources and funding that's going to be needed. It offers a way forward from the dead end of more compulsory treatment and over-medicalisation. I hope today we can see as the first day of a new energised commitment from us all here to going forward under the flag of the UN CRPD. Thanks ever so much, everybody.
Sorry, I was muted there. Thanks, Peter. So over now to Jacqui Lovell, who is going to talk about the right to life and how this is being eroded for us as disabled people through non-invasive prenatal testing and potentially through genomic editing. I got that right?
Yeah.
So, yeah, 4 or 5 minutes then, please, Jacqui, yeah?
Okay. I want to talk about the importance of us being involved in all aspects of the research process, from inception right the way through to the dissemination of what you found. And for me, I wanted to illustrate that by reference to some work that I'd done in the past. So I was working on a program called the D4D program, which is a program that looked at how disabled people, we as disabled people, express and perform in community. Yeah. So I was asked to look at, to do a literature review of genomic editing and non-invasive prenatal testing, which I did. So what I did was I looked at the metaphors that are being used by scientists working in these areas. Yeah. And when I did that, what I found was to me, was impacting on our right as disabled people to even be born. There are countries in the world now that do not have anybody with Down syndrome or living within them have been born fairly recently because of non-invasive prenatal testing. You know, you get to test whether that person has a disability or not through a speck of the mother's maternal blood. And then decisions are made about whether or not that pregnancy should continue. So it worries me the way that this is happening, and the way that the disabled people are, as far as I could tell, not involved in all aspects of that research process. So I'd like to read you a poem that came out of that work, and I apologise in advance for doing so, because it might be a troubling poem for some. So it's called The Mutating Medicalised Morality and Economic Ethics Informing Our Genetic, aka Let's All Play at Being God Today. So I read this at a team meeting because I didn't know how else to share what I'd found. How to tell you what I found, how not to waver or waffle while walking on thin ground. You see, I did not want to do the epigenetic CRISPR review. I thought it might turn out to be the death of me. And to a certain extent, I still do. Only now I've come to understand how it can also be the death of you. Our collective disability to prevent the rent from being wrought, fought and won in the name of commercialisation, playing roulette with its medicalised and harmonised professional etiquette that's designed to help us understand that they won't get us yet, and yet they do, if we adopt a different view. The plain and simple fact is they already impact on our numbers with the advent of prenatal screening from a speck of your maternal blood, so that someone else decides what incidental findings we should be told about, who and how and when these revelations are presented for our consumption, the presumption couched within this labyrinthine wall that has to fall to save us all from making a choice we are ill-equipped to decide if we are not to deride the mixed of mutated happenstance that lies within our chromatin, the dark matter and its place in the evolution of the human race. We need only to observe the actions being taken in the plant life situation to know we're not mistaken. The EU leads the way in obfuscation of the frameworks on which we base our ill-gotten gains. Our regulations and relegation of outmoded and outdated forms of commodification are now de rigueur. Its arms are open wide for all who care to step inside. Quick profits are put before to score another fix for this phallocentric mix. Diversity of flora and fauna will be no more now, as Monsanto's patently taking the piss with its ecological apocalypse. It's why zombie movies are on the rise, because somewhere not so deep inside, we know what we have done in our arrogant assumption that we always should be number one. It's happening now in a clinic near you, non-invasive screening, preening, pruning, ruining, ambiguous in its analysis of incidental findings. What ifs? Reminding us to review and reflect with respect on what is best for you to do, so we can guide you in your decision when the mutant gene comes calling at your evolutionary door. Then ignore what we share only if you dare. You decide, we say, for today. You have a choice. But tomorrow, clothed and cloaked and tied with an austerity pin, we will burst your bubble at the first sign of trouble. We'll be there to remind you that you had free choice. We gave you your voice. We wanted you to be involved. We let you decide the ride you were about to take, the bed you were about to make. So kindly lie down, please, and be appeased, at peace. This is your blessed release from the suffering you'll shoulder until this life is over. So, thanks, Peter. Rights are brilliant. They're wonderful. They're only words on paper until they are enacted and become real. Without our authentic and meaningful involvement, rights are simply, you know, just words or wishes, which is why we as disabled, diverse, mad, crip, spoony and self-defining people need to be involved in research at all and every stage in the process, including the discussion of the ethics and values that underpin the research. Thank you very much.
Thanks, Jacqui. I'm just looking over to see, we don't actually have any questions in the Q&A yet, so if anybody who's listening has got any questions, do feel free to put them in now. Well, if we take perhaps about 5 minutes for discussion before moving on to the next pair of speakers, and I think we'll be about on target in terms of timing. If it's okay, I might perhaps just ask a couple of questions myself to keep things going. Perhaps one kind of mainly for Peter, I guess, but do both chip in. And I'm just kind of wondering in relation to the UNCRPD, kind of what we might do as what we can do as survivor researchers to contribute to getting the UNCRPD and the implementation of the principles in it, kind of get them to be part of the kind of framework of mental health services. It's kind of what we as researchers can do. Right?
I mean, I think the problem that we and our allies face is that we have a politics at the moment which I think is uninterested in those kinds of improvements or changes or revisioning mental health. I mean, I think we've seen how catastrophic its response is to something that's as well known historically, and well known what we need to do about it, and well known in terms of it being physical, its response to the pandemic, which has been, as far as I can see, a catalogue of disasters compared with some nations which have really responded to it in a way that's engaged the people, where politicians have been mindful of their responsibility, people have been sensitive to playing their part, and in fact, the crucial restrictions that we are needing and still needing they are already past them because they behaved appropriately, quickly, and I think democratically. So I think these are bad times for a radical revisioning of our policy. What we need to be doing is finding out more, I think, as survivor researchers, by talking with more survivors, diverse survivors, in an inclusive way, to find out what their concerns are, and seeing the way in which something like the UNCRPD can connect or does connect or can be strengthened, and also to be talking with politicians and policymakers who are more interested in human rights and the diversity of human experience than perhaps our present politicians are. This is all about the future, but not a distant future. And I think that we've got a critical part to play, because we want not only to be involving people, but to be liberating in our goals for research. And I feel that there are strong aspects of the UN document which are consistent with that.
I'd like to chip in on the end of that, if that's okay with you, Stephen.
Yeah, that's fine, Jacqui, yeah.
Yeah. See, as somebody who's really invested in social change, one of the things that I've learned from over the years is that change often doesn't come from the top down. In fact, it comes mostly from the bottom up. So my investment is in all of us knowing and acting on and being aware of and advocating and mentoring and working with and collaborating with each other as a way of building our strength from the bottom. I see that really as happening as part of grassroots organisation. And I know that Peter and that we all really individually and collectively do a lot of that together. So I think the more that we are aware of and know about and hold governments and politicians and other people in positions of power, especially within so-called care services, to account, the better. You know, any organisation performing a public function is governed by the Human Rights Act, but you wouldn't actually know that really when you enter into those services and organisations. But it's a reality that they have to abide by the Human Rights Act. And currently, they don't.
Thanks, Jacqui. I mustn't forget our other panellists. Would anybody else want to come in? Any of you want to come in on that point?
I've noticed there's a question in the Q&A.
Yeah.
I'd really like to answer if possible.
Okay.
Yeah.
I'll go over to that then. Shall I read it out first?
Yeah, please.
Yeah. So this is a question from Paul Radin. Can the panel comment on anything they've observed around conflict between survivor research and public involvement? And he goes on.
Yeah, so he made the point that he is finding it hard to access opportunities in mental health research unless he does it as a volunteer for free. Now, this is something that really personally irks me. I am doing a PhD that has PPI right at the forefront of it, and it is my personal belief that no PPI should be done for free. If you are doing work, and you are doing work as a person with addictive experience, contribute to a research project, that should be fully compensated, that should be paid for, that should be recognised as work. There are so many reasons why that is important. For one, it recognises the time that you've put in. Two, it kind of removes that power dynamic between the researcher and the participant, because it puts you on kind of like a level footing. And three, also it allows people who wouldn't otherwise have those opportunities to be engaged, because perhaps they've got you know, poor financial income and they need to prioritise paid work. We need to get those people into research. We need to give them the opportunity and compensate them rightly. And I see a lot of research that has PPI in it, and I'm like, what have you done? Oh, well, I just talked to some survivors and they gave me their opinions and then I wrote them up. But that to me is tokenism. It's not proper public involvement. It should be very much didactic. It should be done together, and if you're not doing it as collaboration, you're not doing it correctly. It really bothers me, especially when people do public involvement and then they go, oh well, they gave me these opinions, but we kind of already decided where we want to go with our research anyway, and we just did that. If you're doing public involvement in your papers, especially to get like NIHR grants now, it's conditioned to do PPI. You need to be open to those people challenging your preconceptions and your assumptions and your way of wanting to do the research, and be able to move with them. Otherwise, it's not PPI in my eyes. You're just ticking a box.
Thanks, Holly.
Well said.
Okay,
Somebody else has asked about the organisation online, Stephen. They said they've asked us to give a brief outline, but I think, are you doing some of that in your session, Karen?
Yes, I think we will I think I will towards the end. And also I've just posted a link to our website page.
So Andrea, just to say, there's a link there for you to look at, and Karen and Stephen are going to talk about some of that in their session. Mm-hmm. And then Veronique has asked a question as well. Can you see it?
Yeah, so Veronique's asking, can NICE and NHSC be taken to court under the Human Rights Act for allowing psychiatrists to do more harm than good, and ignoring the clear science that supports this concept, and does not support medication and diagnosis in supporting people experiencing distress? Would one of you like to comment on that?
Well, seeing as nobody's coming forward, I'll take that one up. It's the thing about the justice system is that the justice system works for the people who who have power and often against the people who haven't. So what they would do is individualize it and want you to talk about specific individual cases where that has happened, and then that individual person would bring that case. But the amount of evidence that you would need in order to do that would be very, very high. And also, the way they would get out of it would be to quote the Mental Health Act in terms of that person being treated in their best interests when they didn't have capacity, which goes back to what Peter was saying about us holding people to account before it gets to that court process stage. So we're actually doing that in services face to face at the point at which it's taking place. So that to me would be one of the ways in which we could try to effect change from the bottom up. But in terms of the justice system, that, you know, would be at an individual level or a group of people banding together to bring a case. So it's possible, but the chances of change happening, that change might only happen for that one person or that small group, where really we need greater change than that.
Thanks, Jacqui. I think we should go over to our other panellists, the chance to make their contributions now, and we'll catch up on the questions as we go along. So our next two panelists are kind of talking more about survivor researcher identities and the kind of issues arising from trying to do survivor research. So first of all, we have Dina Poursanidou, who's going to talk about survivor research as a lived contradiction. Okay.
Hi everybody. What I would like to do is to read you a series of poems, a series of short narratives that I feel capture my journey in madness and in survivor research, and also capture well, I think, the contradictions I've had to live with. These poems stroke narratives came out of discussions with other survivor researchers. These poems are not telling a linear and cohesive story. They're full of contradictions, they're full of fragmentation and ambivalence. And I apologize beforehand because I believe that a lot of the stuff you'll hear could be triggering for people. I started my PhD in the 90s. I decided to work on my PhD topic following my experience of clinical depression. So in a way, my research career started just after. My kind of service user career started after my first crisis. And following my experience of clinical depression, then I decided to do my PhD. My own experience of depression was a catalyst for my research career. I moved to Preston. I had my second very serious crisis. I was unemployed for a couple of years, and I was also sectioned for 3 months in a psychiatric ward. And when I went back to work after that, I started working as a service user researcher. I think I couldn't have gone back to a mainstream research job because of what I had lost. Being a service user research fellow, I did struggle a lot with confidence and with delivery. I had a lot of criticism from the people who managed me, you know, my boss, because obviously I wasn't delivering 100% to start with, of course. I was out of work for 2 years. I nearly killed myself. I was severely traumatized through the sectioning, and I had to relearn research skills. I could hardly read a book when I was ill. So going back to a researcher job and being expected to be the person I was before, plus the experience of detention, is, well, to say the least, laughable. I started to become ill in the summer of 2008, although probably I started to become ill a lot earlier. That's when I went off sick. And I was becoming more and more unwell. I was suicidal. I was really depressed. And also I was having paranoid thoughts. I got up one morning and I said to my mum, I want to get a knife and kill myself. I was taken to an assessment unit, and I don't remember. I remember very little. and I don't remember. And I think the following day I was put on a section, and then the following day I was taken to a ward. My first time in a psychiatric hospital and my first time sectioned. Nobody explained to me what section means. I felt really as if I was in prison. I think I was terrified. I was really drugged up to my eyeballs. I was restrained. I escaped twice from the ward. I think my attitude towards my mental distress and my mental health service use, and also my being a service user researcher, has got a lot of ambivalence in. Me that can see how my experiential knowledge, and me that wishes that I never had anything to do with all I've lost because of all the trauma. I worked for 3 years, which was my last job as a service user researcher. I did an ethnography of psychiatric wards. I spent 15 months on wards. I don't think I will ever do anything more difficult. I could not believe the kinds of childhood I was like being exposed to. I remember going home and feeling knackered because absorbing all. I mean, they were very, very severely self-harming. I mean, they were attempting suicide. People were swallowing batteries. I would have to be on these wards for days on, not just do an interview and leave. It was by a service user researcher, actually, the article in The Guardian. The article talked about mental illness as an advantage. That was the essence. I wrote, when it pays to have psychotic depression, it did pay. It did pay to have had psychotic depression, but all that paid, but also there was the biographical disruption, the unemployment, the stigmatization, all of this. You know, some researchers have been mentally ill, are able to go into universities. You have, well, to some extent, valuable insights. Somebody who is regarded as having no insight to be celebrated as somebody who had valuable experiential knowledge and expertise by experience. For service user researchers in particular, because of our gaps in our CVs, because of, for example, not having the publications we would have had if we didn't have all these breaks in our employment trajectory. We don't start in the same sort of place. Our mental health fluctuates, for example. We can't be as productive. And then in terms of career progression, they designed my post as part of the funding application. They hadn't thought about support. They thought that they would just throw somebody in these wards and the person would cope. How to survive as a service user researcher in the neoliberal university when I'm acutely aware that my valuable lived experience of mental distress and service use, in inverted commas, aside, I'm actually someone with a stigmatized social identity, the identity of a mental health service user, and therefore I'm a liability when my academic worth is measured on the basis of productivity and publications in high impact factor journals. Thank you. Unmute.
Yeah, sorry. So I should be good at this. Yeah, straight over to Holly then, who's, thanks Dina. Yeah, go to Holly now and is going to speak about survivor researcher identities as a PhD student.
Yep. So to give you a bit of context, I am a PhD student at the moment in clinical psychology. I am researching what it's like to experience severe mental illness, substance misuse, and suicide. I have been through the mental health system myself from a young age, including being sectioned. So I very much understand what is being talked about in the comments at the moment. I feel for you there. I resonate with what you're saying. I'm also a suicide survivor. So doing a PhD on suicide is a very salient topic for me as someone who ended up in intensive care as a result of a suicide attempt. But I've just written a little bit that I'd like to kind of read to you and get you all to think for yourselves, because I think we all learn from doing our own thinking based on our own experiences. So I want you to think a little bit about the identities you may inhabit: mother, sister, daughter, father, brother, partner, researcher, survivor. We all have multiple identities, and oftentimes these identities can interact. Sometimes some of these identities may be seem more salient for us than others, such as when we are caring for a loved one or in our professional roles at work. Sometimes some of these identities may even feel in conflict with one another. For example, you may feel conflicted by your obligations at work when you have a sick child at home, or perhaps someone says something at work that unsettles you as a survivor and you feel the urge to challenge it without wanting to upset your colleagues or necessarily reveal your personal private experiences. The problem is that being a survivor also carries a lot of stigma, and there may be times where you feel like your position of relative privilege as a researcher also affords you a level of responsibility to your fellow survivors, which may at times pose a challenge for you for your own personal well-being or career development. After all, constantly challenging the negative stereotypes, attitudes, and beliefs of others towards those with mental health problems can be extremely emotionally draining and does not come without a personal cost. I've experienced, for example, first-hand discrimination from employers in the past on revealing my survivor status, which made me feel so uncomfortable at work that I ultimately had to leave. I should know that this was not a research role, but I have colleagues who have extremely similar experiences to me in academia, so it is not immune to ignorance nor prejudice. There may even be times when revealing your survivor identity may be detrimental to your role as a researcher. For example, if you are conducting a qualitative study in an area you have lived experience in, revealing your identity to participants may result in a sense of over-familiarity, where they assume they already know what you are talking about and do not give a detailed answer, meaning your data might lack the rich detail required for subsequent analysis. So how do we resolve these conflicts when we inhabit multiple identities, some of which may overlap and/or conflict with one another? I think there is no answer to this question, as it varies between circumstances and people. I think what is most important, however, is to always check in with yourself. How would you feel if you said something and were treated differently as a result? How would you feel if you didn't say something? What is your role in this particular circumstance, and which identity is it necessary to prioritize? How can you reconcile your multiple identities at work and at home to maximize your emotional well-being? This is something I am constantly reevaluating and reflecting on myself as a survivor researcher, and I encourage you all to do the same.
Right, thanks, Holly. We have a question in the Q&A from Mark 184, which seems to be very relevant to contributions you just made. So I'll just kind of read that out. Hello panel, what do you reckon aspiring survivor researcher needs in their toolkit to do the best survivor research possible? We have to take a few minutes on this and then we'll go to Karen for her contribution.
Can I comment?
Yeah, take Dina and then Holly, yeah.
Well, I don't even sure what the best survivor research possible is. I mean, I can only talk about my experience and also from, you know, talking to other survivor researchers. And it's not so much about toolkit, it's more about being aware of, for example, I mean, research doesn't live in a vacuum. I mean, being aware, for example, what are the debates amongst survivors at the moment? So, you know, being able to listen to other survivors, being able to tolerate conflict, because mental health is full of polarization. Mental health politics is very polarized. So, you know, being able to tolerate, you know, opinions different to yours, and sometimes perhaps also to be open to research that you wouldn't do. For example, I can't speak for other people, but I wouldn't want to have ECT ever. So it's in my advanced directive. So I don't think I'll want to take part in an ECT study. So, I mean, these things, you know, being aware, being honest with yourself, being open, being aware of power dynamics, because whatever we say when we, you know, when we work in research, the power differentials don't break. We're not, we have some power over the people we interview, for example. I don't know if that answers the question, but, and also I think something very important is being able to talk openly with non-service user researchers, non-survivor researchers. Well, of course, that means some reciprocity, whether they will be able to talk with us, but yeah.
Thanks, Dina. Polly, did you want to?
Yeah. I think for me, the biggest part about being a survivor researcher is being a survivor. If you struggle with mental health problems, doesn't matter what career you go into, you will likely always struggle with them. I'm not saying that, you know, you can't have periods where you're relatively well and there aren't things that exacerbate your mental health, but if, like me, you've had them ever since you were very, very small, maintaining your mental health has to be your main priority. And do not be afraid to ask for help. Do not be afraid to take kind of any resources offered to you. So for me, I was very reluctant to engage with disability services throughout both of my first 2 degrees because I didn't want to be labelled a disabled. You know, because I'd just come through the mental health system, I'd been sectioned, I'd been on a community treatment order, I didn't want to seem different to my peers. But then I found it really, really hard to get through my degrees and ended up in and out of hospital. I'm now doing my PhD and I've taken 15 months out after a suicide attempt. I'm totally honest with my supervisors, they know about my past experience, I'm taking all the help I can get, and it's a million times easier. Because, you know, we do deserve that support, we do deserve that additional kind of compensation or those allowances, because when you struggle with a health condition or a physical condition that does put you at a disadvantage to other people from the off, you shouldn't be expected to do exactly the same things without some additional help. And don't be ashamed of that. It took me a long time to learn that, and I wish I'd made things easier for myself, because I didn't need to be as ill as I was. I could have had a better quality of life. And now that I'm learning to ask and reach out for help and, you know, ask for space when I need it, it's making it so much easier to be a researcher, because I'm prioritizing my need to be a survivor first and foremost.
Thanks, Holly. If it's okay with our other panelists, I'll go. I think let's go over now to Karen. To kind of make a contribution, and then we'll we can then kind of take some further questions and discussion afterwards. Yeah. Okay.
Thanks, Stephen. Thank you. And I guess part of my answer links into Mark's question around what is the best survivor research, and to me that is about having research that addresses the questions that we as survivor researchers are asking. And I think that's a real problem for us, and that we don't often get that opportunity. I think survivor research is unique and it's rich, and we've got multiple voices and perspectives that are included in that. And we've got a lot to offer that should be welcomed as we aim to build back better, I think is the phrase, isn't it, at the moment, and with innovative projects that can support our communities. I think survivor research should be welcomed, but it's hard to get that opportunity. I think there are a lot of people with the skills to do survivor research, so I think you can look at the panel today and there's lots of people who are interested in the questions in the chat. It's great to see lots of people there with expertise in survivor research. So there's people both locally in England and also internationally that we've got in our networks, some people who've got posts in academia, and, you know, plenty of people doing survivor research, as well as a lot of people who are interested in it and trying to find out how to use those skills, maybe coming in it from a PPI route, for example. But people who are asking questions and looking for some answers around survivor research, but who might not use that language and might not call it research, they might just call it asking questions. So I think there's lots of people around who could get involved in this, but there seem to be some real structural barriers as to how we take it forward. And for me, that's a problem. And I think there was a question in the Q&A there around sort of the funding for research and what happens with that and where we can find it. And I think that is a real challenge for us. I think traditionally we might look to some of the bigger organisations. So NIHR is the obvious one, the National Institute for Health Research. They're the big funder for research in our field. So we might question what they're doing. And we know that there is a lot of work they do. They do push for involvement. There's been a lot of work around going the extra mile and breaking boundaries. They've got involved. So there's lots of work being done there around involvement, but how does that push towards survivor research? If we see patient and public involvement, or PPI, is like a baby step towards survivor research, maybe we should be taking a closer look at that as survivor researchers, and questioning maybe why NIHR hasn't got a pot for survivor-led researchers to apply to, and something that specifically emphasises our skills. Maybe we should also be looking at the proportion of money that gets spent on PPI. If we say that 5% of any project proposals should be on the funding for PPI, how much is that? So recently, I don't know, take one recent successful funding bid, it was for £500,000. 5% of that is £25,000, which doesn't sound like an awful lot of money, perhaps to these bigger organisations. But to us as survivor researchers, I think we could do an awful lot with that, especially when you compare it to the work that NSUN have done recently with some of the funding that they've been giving out to small organisations. So I think big organisations like NIHR really ought to listen to us, and how do we get in on that conversation? There are other organisations that I think have also got pots of money that we should be accessing. So there's a lot of talk about co-production, isn't there? But co-production is quite often accused of being tokenistic. And I think that's partly because the questions are already there and they're seeking the co-production on answering those questions. And I wonder if as survivor researchers, maybe some of those organisations could be doing some creative commissioning and commissioning survivor researchers to find out what the question is in the first place, before then going on to try and work out what the answers are with their local communities. I think fundamentally it's going to be really difficult for us as survivor researchers to access a lot of this funding. I kind of give up at sometimes, give up looking at the larger institutions. They've not supported us so far. And for me, it's about going back to our value base and thinking about what's the purpose of our own work and how can we use our skills to elevate and support each other within our community. Because at the end of the day, for me, survivor research is about making a difference within our communities. It's not about writing that research report that can sit on a website somewhere. So for me, I just question there are some spaces for research maybe that beyond mental health. Mental health is on the agenda, so how can we get out into those other spaces? Maybe we could have spaces and conversations, perhaps with people who are doing creative practice, maybe looking at artists, maybe just looking at different places, thinking in terms of things like labour exchange, thinking in terms of service evaluation. You know, how could we use our skills as survivor researchers to support service user-led groups with their funding? Should we be having conversations with their funders? So I think there are some opportunities out there and some places that we could be looking and searching and thinking about what are the opportunities for funding that could perhaps support us with our bids for survivor research. And after 2020 and the way things have been over the last year, I think we're all rethinking how to move forward. But I'd like to finally sort of put in a plug really for the Survivor Researcher Network before passing over to Stephen, because I think that is one network and one organisation that can provide us with the support with each other to talk together and think about how we can take these things forward. Thank you.
Thanks, Karen. Yeah, if I could just add a few kind of brief points, maybe just to kind of take that on to say a little bit more about our priorities and kind of plans for the future. We have been talking about different options for kind of setting up the SRN as a kind of distinct organisation, still linked with NSUN, of course. And in the course of that, one kind of key aim there is kind of opening up the involvement in SRN to a wider circle of survivor researchers than is kind of really the case at the moment, where we have a bit of a gap between the working group and the two monthly bulletin. And we, in the course of that discussion, we kind of came to that kind of four kind of broad areas which we seem to be kind of good aims and priorities. First one was the generally kind of raising the profile of survivor research and being kind of respected as an organisation to talk about survivor research as a distinct way of doing research. And of course, our manifesto, which is available on the NSUN website, is a kind of good summary of some of those kind of core values. And then the second area was kind of addressing issues of power and discrimination that occur in the research world, of course, also in survivor organisations as well. And that really needs to be another kind of key area for us. And then the third area was Karen's already talked about in terms of getting funding for doing survivor research, and that kind of developing into an organisation network which is actually able to be doing user-led research and then user-led evaluation of other people's researches. Obviously a kind of core aim. And then finally, well, perhaps I should say fourthly rather than finally, looking at survivor researchers themselves and building support and resources for survivor researchers in terms of the support networks, which kind of links in with what Dina and Holly have been talking about, but also resources in terms of collections of writings and other materials that are out there, but at the moment can be difficult to find. So if anybody has any within the our audience, which I unfortunately can't see, and the panel wants to come in on any of the points that Karen and I have raised, do please post your questions in Q&A, or panellists attract my attention like Holly over there.
I think there was a really interesting question posted by Katie. She was asking how you distinguish being a survivor researcher from being a researcher who happens to have lived experience in mental health issues. I think personally, if you are doing survivor research, you're basically saying that your experience will somehow influence or shape the research you're doing, and that you will bring the insights or the experiences you've had into that research. Now, for me, I'm doing clinical psychology, and it's really important in clinical psychology to always reflect on how your own experiences and beliefs shape the work or the practice you do. So there will be an entire chapter in my thesis reflecting on my experiences and how that has shaped my approach to the topic, how it shaped my hypotheses, my questions that I'm asking, and also how that affects my relationship with the participants, because it will have an influence on the data that I'm able to collect and how I analyse that. I don't think that's something that should be unique to clinical psychology. I think all disciplines can reflect on how that experience shapes their research, and I think our research would be much stronger for it, more transparent. And I think being a survivor researcher, I'm explicitly saying that I am not coming to this completely objectively, but I bring a unique and useful insight that I am going to use in my research, just as if you're doing kind of like an autoethnography. You're basically saying I'm analysing my own experiences and bringing that to bring about insights or kind of frameworks that you might not be able to grasp just from reading the literature alone, especially if you're doing a topic like mine where there's pretty much no research out there. You're able to say, well, I'm not coming at this from a naive perspective. I have my own thoughts and insights about this, and I'm using that to go into the research and test them out with participants.
Thanks, Holly.
Can I jump in at that point? Is that
right? I haven't spoken for some time.
Yeah, go to Peter and then you, Jacqui. Yeah.
You asked for comments in relation to yours and Karen's presentation, and I just wanted to say that I love the fact that Karen's, at the end of it, she sort of, it's like we've gone back in a full circle because she brought values into that. And there's a lovely comment, there's a comment from Colin King in the webinar chat that says, what if the research tools are white and Eurocentric and collude with a racialized diagnostic system, then the outcomes for specific radicalized communities, and You know, it's like, I think we can't even begin to discuss all of this without talking about the need to decolonize and to look at the experience for more than just this white privileged world in which we live. And I know that one of the aspirations that we talked about in the book chapter that we published was about us sitting in our uncomfortableness and sitting with our discomfort and asking ourselves awkward questions, and then not just doing that, but then going out and putting it, you know, taking that way of doing work in a critically reflective way out into our worlds. So I sort of just wanted to note that critically important comment from Colin.
Thanks, Jacqui.
Peter, yeah. Pick up on that as well as also I wanted to stress how valuable I think it is what Holly had to say about treating lived experience and experiential knowledge with equality. And I also want to thank Colin King for all sorts of things, but not least for an opportunity to take part from a Jewish perspective in a seminar which was so helpful, which he organised around whiteness and white privilege. One of which qualities I think we so rarely get was that the majority of people there were black and came from minority ethnic communities. And those situations of reversing the usual arrangements of who is part of the conversation are critical. And those big organisations who have the resources to do that are not doing it. And I hope we'll do more of it. I just wanted to go back also to the kind of the issues that Holly was addressing, which is what's special about survivor research. And I'd link up briefly with what I think we learned also from disability emancipatory research, that one, we're aiming for equality between the researcher and the researched, that they're not one over another. And two, that research is, as someone's already emphasised, about the personal empowerment of the people who are being researched or part of the research as co-producing partners, as it should be. And finally, that the whole purpose of research should be to make social change. And that's what we've so far not been getting, I think, enough of, certainly from medicalised mainstream psychiatric research in the context of mental health.
There's some more questions there. There's one by an anonymous attendee that says, what do you think is the single most oppressive tendency of mainstream research practice and philosophy? And what is the most effective and practical, I would imagine that they mean, way of challenging this in the panelists' opinions and experience? Anyone?
Yeah, I've been told it doesn't matter if we just go over just a few minutes. So, Dina, yeah. Dina?
I'm not sure if there are oppressive, well, there are oppressive ideologies and standpoints, but in my experience, there are more oppressive practices. And sadly, a lot of, oh, not a lot, some people who, you know, profess, I have to be very careful what I say here, profess being pro-social justice, pro-ethical research. They go on about feminist and post-structuralist research. They are oppressive in their practices and how they treat their colleagues, how they treat, I'm talking about senior people, so how they treat junior researchers. So in my, you know, I think we need to be more careful and cautious when we talk about oppressive mainstream research, because there is abuse of power in survivor researcher circles as well, and that's what we need to be looking at.
Yeah, so it's really important to maintain our own criticality. Yeah.
Thanks, Dina. We are kind of really just about out of time now. Do any of our panelists spot any questions that we really ought to just try and quickly answer?
There's a conference. I think Colin's put a link to a conference.
All right, right.
Yeah, that should be helpful. And
Yeah.
we need more of these occasions, don't we? How often?
Oh, massively.
To talk to each other. That's
Yeah.
what's.
Well, we're holding a webinar. We're having one of our own, aren't we, as Survivor Researcher Network members in December.
That's right, Jacqui. Yeah, that's.
Oh, sorry, Peter, have I stole your thunder, Steve?
No. If you if you go on, you announce it if you like.
Well, just to say, I mean, can you remember the date, Stephen? Because I can't.
Yeah. So what we're planning to do, this is kind of particularly around that kind of support element in survivor for the SRN, but a bit broader than that. We're also talking about survivor research. So what we're planning to do is to organise a kind of discussion support group over Zoom, of course, and that's set for Wednesday, the 16th of December at 5 o'clock. We will obviously be publicising that. For it to work well, we'll probably have to put a numbers limit on it. So I think it'll probably be one where you need to register. And we're hoping that'll be the first of an ongoing discussion and one way of involving a wider circle of survivor researchers and the 10, 11 of us who are on the working group. I think that's about all for us now. You can find out more about the Survivor Research Network on the NSUN website. If I get a chance, I'll post the link again in chat before we finish. Any of our panelists want to quickly say anything at all before we wrap up?
Thank you so much to everyone who's attended. You've been great.
Yeah, absolutely. That's the point.
Yeah, and thanks from me too. It's a rather kind of strange experience not actually being able to see any of you. So, if you're still out there. Okay then, so we'll finish now, and if our organisers can just give me a moment to post that link.
Thanks to our chair too.
Yes.
Thanks.